Hello, my name is Josh Tompkins. I'm a firefighter first class for Clarksburg Fire Department. I'm also a student at Pierpont Community and Technical College in the paramedic program. This is the second video in a series on patient assessments. In this video, we'll take an in-depth look at the primary assessment. The primary assessment is the second component in the patient assessment. There are multiple components within the primary where we will make decisions based upon our findings. These components form a general impression, determine responsiveness or level of consciousness, determine the chief complaint and apparent threats to life, assess airway, breathing, and circulation, assess disabilities, expose, identify priority patients, and finally make transport decisions. We can use a mnemonic to remember these components. I like to use ILOC Chief, ABCs, DEs, and PPTs. Let's explore each individual component. First, forming a general impression. This is done from across the room or your view from the door. It'll help us determine if our patient is sick or not sick, and will dictate how we proceed. We'll use the assessment triangle here. The first leg of the triangle is appearance. Because fire and EMS love our mnemonics, we'll use another one here. That mnemonic is FEDSO. F for facial expressions. Is the patient grimacing in pain? E for eye contact. Does the patient make eye contact when spoken to or approached? A very sick individual may not. D is for dress, hygiene, and grooming. A very sick patient will not care what they look like. S, does the patient speak when spoken to or when they're approached? And O, are there odors, body odor, breath odors such as alcohol or a fruity smell? Is there an odor of vomit or urine? The second leg of the assessment triangle is work of breathing. Get ready, another mnemonic. This time we'll use WARF. W is for words per sentence. Is the patient using 2 to 3 word sentences? A, are there abnormal sounds or positions? Can you hear stridor or wheezing? Is the patient tripoding? R is for retractions. We're looking for muscular retractions in the neck and shoulder area, obviously indicating a work of breathing. And finally, F is for flaring. Nasal flaring is a good indicator that the patient's trying to get more oxygen. The third leg is circulation. Think of the Old Glory and the red, white, and blue. What color is the patient? Red could be from fever, sunburn, allergic reaction, carbon monoxide poisoning. White can be a sign of anemia or hypoperfusion. Blue or cyanotic can indicate a lack of oxygen. We will also note the patient's gender, age, and weight during our general impression. Next, we determine responsiveness or level of consciousness. ILOC, L-O-C, level of consciousness. It's a mnemonic time. Once again, AVPU, A-V-P-U. This is what we use to determine our level of consciousness. Is the patient A, alert? Do they respond to verbal stimuli for V? P, do they respond to painful stimuli? And U, finally, are they completely unresponsive? If I walk in and say, how are you today, sir? And I get an answer, my patient is obviously alert. If they're alert, we're hoping that they're oriented. We use alert and oriented times 4. And by times 4, I mean oriented to person, place, time, and event. We can ask these questions to determine. Do you know who you are? Do you know what day of the week it is? Do you know where you are? And what's the reason you called 911 today? If the patient is not alert, they may respond to verbal stimuli. Sir, are you okay? They may only move or moan, but that is a response, and that is a response to a verbal stimulus. Maybe the patient does not respond to the verbal stimulus. We can take our knuckles out, perform a vigorous sternum rub. The patient may guard or withdraw from the rub, indicating that they are responsive to a painful stimuli, so they would be a P on the AVPU. And finally, if no response to all the above, they're a U and unresponsive. Moving down through the components of the primary, we come to Chief, ILOC chief. Determine the chief complaint and any apparent threats to life which we would need to treat immediately. A good EMT or medic is also an investigator. We have to ask questions to use the answers to help us make our decisions. If the patient is unable to answer our questions, perhaps we can ask bystanders, family members. We can also scan the environment, might see medication bottles, might see illegal drugs, might be able to take in any kind of clues that could give us an idea of what actually happened. Next, we look at ABCs. ILOC chief, ABCs. ABC stands for airway, breathing, and circulation. We'll assess the airway. In an alert patient, if they answered any of our questions, we know they have a patent airway. In an unresponsive patient, sometimes all that's needed for a dyspneic patient is to open that airway. If trauma is suspected, obviously we can't use a head tilt chin lift. We'll use a jaw thrust maneuver and get that airway open. Then we can lean down. We can look at the chest, looking for equal rise and fall. We can feel and listen, feel the breath on our face, listen for air movement. We can also smell the breath, take a whiff, and see if there's any out of the ordinary odors present. Then we can secure that airway with a simple adjunct. While we're assessing breathing, we'll question whether the respirations are adequate. Are they too fast? Are they too slow? We aren't worried about an actual number here. We just want to know if it's too fast or too slow, and if they're adequate or inadequate. Now would be a good time to provide high flow O2 as needed. ABC's circulation. Assess and control any major bleeding. Obviously, if we discover major bleeding, taking time to secure the airway first is not going to do us any good if the patient is bleeding out. So we'll control that major bleeding first, then secure the airway. For circulation as well, we'll look at skin color, temperature, texture, turgor. We can place a wrist on the forehead. That gives us several different senses. Are they cool, clammy, diaphoretic, pink, warm, and dry, ideally. Obviously, sick people are not usually pink, warm, and dry, unfortunately. So, then we'll check for a pulse. Feel for a radial pulse first. If there's no radial pulse, we can go to a carotid. Again, we're assessing the rate and quality, but again, we're not looking for an actual number here. We just want to know that the pulse is present. We'll determine if it's too fast or too slow, if it's weak and thready, or bounding, full, and normal.
140 Seneca Drive, Clarksburg, first one drive.
Moving on to the DEs. D is for disabilities. We'll assess the pupils. Mnemonic time again, PERLA, PERRLA. Pupils equal, round, reactive to light and accommodation.
140 Seneca Drive, 610.
We'll check one pupil with the pen light. Take it away. Check it again while looking at the other pupil. Are they equal? Are they unequal? Are they slow? Are they sluggish? Are they fast? How do they look? Next is E for expose. DEs. ILOC chief. ABCs. DEs. E for expose. We'll expose the chest so we can have a good look and a good listen to both lungs bilaterally. We can also look at the torso for decap BTLS, any other clues that might help us figure out what happened. When we're through with that examination, we would cover them back up so we don't lose any body heat. Finally, PPTs. ILOC chief, ABCs, DEs, PPTs. PP stands for priority patients. We need to determine if we have a priority patient, which is going to lead right into the T's, which is a transport decision. Do we need to load and go, provide further assessment and treatments en route to the hospital, or can we stay and play, provide a little more assessment and do some treatments on scene? All depends on what kind of patient we have here. So, those are the main components of the primary assessment. Let's review real quick. ILOC chief, ABCs, DEs, PPTs. I for general impression. This is from across the room. Are they sick? Are they not sick? ILOC chief, level of consciousness using that AVPU. Are they alert and oriented times 4? Chief complaint and immediate threats to life, we're going to treat immediately. ABCs, airway and breathing. Is it open? Let's look, listen, feel, smell, secure. High flow O2 time. Then circulation will control that major bleeding. Is there a pulse present? What's the skin, color, temperature, condition? Assess disabilities. Pupils, equal, round, reactive to light and accommodation. Exposed to examine. And then ID our priority patients and make our transport decisions. Thank you very much. I hope you guys have enjoyed this video. Stay tuned for the next one in the series. Thanks.